Hello everyone, I'm Dr. Chandan Narang. I'm an orthopedic surgeon and today we will deal with the sternoclavicular dislocation. What happens in case of a sternoclavicular dislocation? Your clavicle dislocate due to because of a traumatic injury. It can dislocate anteriorly, it can dislocate posteriorly. So there are two types of dislocation. One is anterior, one is posterior. Which is more severe, which is more common. The posterior one, it is the more severe one because it goes into the thoracic cavity, and the anterior one, it is the most common one. Whenever you see a bulge on this portion in the sternoclavicular area after a traumatic history, you should suspect there is a sternoclavicular dislocation. Now, if there is a one thing you need to rule out is the history of any infection, history of any fever before, because the infection of this area is also very common, especially in case of a drug abuser. The sternoclavicular infection is the rate of this infection is very high in this area in case of an IV drug abuser, and the organism found is the Pseudomonas. So let's again come back to the anterior versus posterior dislocation. How will you identify on the basis of X-ray that the dislocation is anterior or the posterior? So if you get the normal AP view of the chest, you will not be able to differentiate whether it is a dislocation or it is normal. So you need to get a serendipity view. In case of serendipity view, you need to direct the beam from the cranial to caudal in the 40-degree direction. In that way, you can differentiate, okay, from the normal to the dislocation part. And with the help of this X-ray, you can also differentiate whether it is anterior or posterior. If suppose you mark an outline of the opposite clavicle, if the affected clavicle is going upward, it is appearing up to the contralateral clavicle, so it is a which dislocation? Anterior dislocation. And if it is down, or we can say it is inferior to the opposite clavicle, it is called as posterior dislocation. So this is how we differentiate. But there's one more thing. On the X-ray, it is very difficult to identify this dislocation because you need a good technician, not available, and you also need the good eyes that will come with the expertise. So it's better to get the CT scan if you are suspecting sternoclavicular dislocation. Now, how to suspect the sternoclavicular dislocation? Anterior dislocation you can easily suspect because there will be a bulge after a traumatic history. Now, regarding the posterior dislocation, if the patient is complaining of dysphagia and stridor and some neuropathy complaints in the affected side upper limb, as well as some pulsation problems, and if he is also having while doing the abduction of the arm, he is also having some pain or difficulty, it means, and that pain and difficulty is supposed to be here only. With the movement of the arm, the pain and difficulty in the sternoclavicular area, then you can suspect it is a posterior dislocation. Now, the best investigation in such cases to get the CT scan, because it will tell us clearly whatever the dislocation is, anterior or posterior. There is one more thing. It also one more advantage of CT scan. If suppose you are having a patient with the adolescent age and one is of the adult age. In adolescent age, there is a physeal injury can also occur. So we can differentiate in the adolescent part whether it is a physeal injury or it is just a dislocation. So CT scan is the best one. So you know about the sternoclavicular joint. It's a diarthroidal joint. It has got the superior and anterior as well as the intermediate disc. That is not important here. The important part is it is a dislocation. It is a joint. It got dislocated. Now, for any joint in the orthopedics, you need to reduce it first. The first thing you need to do is reduction. So how will you reduce it? Suppose anterior dislocation is there, you can do the abduction of the arm, give the axial traction, and you can press it simply, not too tightly. Okay, no, do not apply too much pressure. Okay, it can be reduced. So in case of posterior dislocation, you can reduce it, but it is little bit difficult. But after these reduction, you have to give a valve bandage. That is the ideal thing to do. So you have to reduce and give the valve bandage. Now, if the patient is coming after 3 weeks, so now let's differentiate. If the patient is coming before 3 weeks, it is the acute stage. If it coming after 3 weeks, okay, then it is like a chronic condition. In case of chronic condition, you can try the close reduction, but if it does not happen, you're not able to reduce it, then you should intervene with the open surgery to reduce it, to fix it. And just remember one thing: whenever you are working in this area, always keep a cardiovascular surgeon ready along with you, because this is a high risk area. You will be working near the vascular structure, so keep a cardiovascular surgeon on the call. Okay, now the next thing is there's a one more procedure. They used to excise the middle part of the clavicle, but that is extinct, basically rare now. Don't do that. Nobody does it. So this is all about the sternoclavicular dislocation. So if you like more of such contents, more of such videos, more of the direct videos on this such kind of orthopedics content, please write it on our wall. Thank you, and stay tuned and follow us.